Hello again and welcome. I am Connie Wray, and I'm excited to moderate the 7th episode of Talk It Out Tuesday, a weekly interview series where Crisis Support Services of Nevada partners with experts to dive into some of the most current issues during the COVID-19 pandemic. In this episode of Talk It Out Tuesday, we are discussing how the state of Nevada has recognized and responded to concerns that are arising for our older population in our communities due to this pandemic. And this episode is truly dedicated to you, our senior citizens. You are absolutely a vital and vulnerable part of our community, and we should all consider how our current situation affects others that surround us instead of just focusing on ourselves. And I'm very excited about this episode because I think it's really important that we recognize our seniors. If you have a senior citizen that's in a senior home right now, a grandparent or a family member, this might be an opportunity to really reconnect on their level, maybe writing them a note, or if they have a cell phone, making sure that you're constantly sending pictures and touching base with them. And this is really what this episode is about, is really giving our seniors the tools that they need, because we know this is an extremely difficult time for them. Many of them are isolated and away from the life that they so live for and so enjoy. I feel very lucky because I live in a neighborhood with several elderly people on my block, and we've gotten to know them over the years. And it was one of the first things that my husband and I did was really reach out to them and make sure that they knew that we as neighbors were there for them. We've picked up bread or done some small things here and there to help them out. So I'm very excited for this episode, and we will be highlighting the many of the concerns that our seniors have. We're also going to be hearing from the state of Nevada of how they're responding so that they too can help our senior citizens get through this very challenging time. With us today for this discussion is Dena Schmidt from Nevada's Department of Health and Human Services, and Crisis Support Services of Nevada's Executive Director, Rachelle Pellissier, joins us as well. Thank you both for being with us today. Dena, can you share with us what your team discovered that prompted the response Nevada Can?
Absolutely. Thank you so much for having us, Connie. So, as the governor declared an emergency and asked us all to stay home, one of the things that we recognized was that there are over 455,000 older adults, older Nevadans, being asked to stay at home. Many of those being asked to stay at home previously had been quite independent, frankly, able to do whatever they needed to attend to their basic needs, their healthcare needs, as well as, social interactions. And so our concern was really focused on how do we help those 455,000 newly isolated older Nevadans connect to resources? Many of them may have never needed assistance in any way or never quite needed our services, but we wanted to make sure we created a really simple way to request some help to protect our older Nevadans to stay at home during this time. We know that seniors are at the highest risk for exposure to COVID-19, and the consequence of exposure for those seniors is something that is a little bit scary. And so we wanted to make sure that seniors had a simple way they could call 211, or they can go to nevada211.org, ask about Nevada Can. We have resources that can deliver groceries, deliver meals, as well as medications. And then the second area we wanted to focus on was making sure that they had continued access to their healthcare. So through telehealth services with several of our community partners, both the University of Nevada, Reno, and the Nevada Sanford Center for Aging, we offer telehealth services so that seniors had an ability to stay healthy and stay connected to their medical needs. And then the last area we really wanted to focus on was social connections. We know that many seniors were very active in their communities, and now they were being asked to stay home and not connect. So we have a group of folks that work with anybody who's interested in maintaining social connections. We can do that through one-on-one check-in calls if somebody just needs to be checked in on and talk with somebody a couple times a week. Or we also offer group activities, virtual, both telephonic and on the internet. A couple different formats where people can just stay connected to their community, to their friends and their neighbors.
What I love about this is that you got a huge group of volunteers that are coming in to help out our senior population. We all know that seniors are so very susceptible to the pandemic, and that must just be so frightening for them to worry about their health, but also have needs outside of the house. And some of them do have family, but they can't even get close to their family if they're not living with them. So having a group of volunteers that came together to help create this Nevada Can system, I think is just brilliant on the state's part.
It really is exciting. Our network, our aging network is made up of state, county, local governments, as well as many, many nonprofits and community partners who, like you said, came together in just a few days. I think from the day we decided to do this, we brought this up in 10 days. 211 has been an amazing partner, and they were able to create a link on the website for that resource where folks can just go ask for some help, tell us what they need, and get referred to the appropriate services.
Rachelle, at Crisis Support Services of Nevada, are you seeing an increase in calls from the senior population? And if you are, what are some of the concerns that they have right now?
The culture of the senior population is not to reach out and ask for help. But when they do call in, they have the same concerns as most everyone else, isolation, not being able to get their vital supplies that they need, food and especially medication, not knowing how to get out and get it, not wanting to reach out for help and ask for the help. They're so unused to asking for help.
Dena, I have a question for you in regards to the number of seniors that are living in senior facilities right now. I know that this is another challenge for families because if you are in a senior living facility, you're not able to visit that individual. What are some ways that you can still stay connected to those seniors if they are living in a senior facility?
So the first thing people can do is just call, stay in touch, call your loved one, call your friends if they're living in a skilled nursing facility or a senior assisted living facility. Reach out. If you're having difficulty reaching out, certainly advocate for those individuals. I just encourage everybody to be an advocate.
We and the Aging and Disability Services Division work very closely year-round, not just during this crazy time. And we'll help you to help your senior. We'll help you to help yourself. So please reach out.
Agreed. We can't say that enough. And I think that many people are afraid to reach out, and especially social isolation during this time. Many people may be worried about, they don't understand how to use their cell phone or an internet connect. They're not sure about the technology. So if you have a loved one in Nevada and they need some help with that, part of our social services connections really is we have some great volunteers, some university students who are willing and available to provide technical assistance. So if you're having a hard time with a loved one here in Nevada and you haven't been able to connect to them because they can't use the technology, we have volunteers that are ready, willing, and able to help with that and provide that technical assistance so that they can stay connected to their loved ones, to their friends, their family members. So please do reach out to Nevada Can and let us help you stay connected to your community.
Dena, who would you like to see take advantage of the Nevada Can program and its services?
We focus the efforts around older Nevadans, but we really have noticed that there's a need for various populations, those with disabilities, any vulnerable populations. We really would encourage anybody that needs support to stay home. I think as the state begins to reopen, there will continue to be those people that have to stay home or should be staying home. And so this service is available to anybody. We will find a way to get you connected, whether it's through one of our programs or a community partner program. We really are focused on trying to help prevent the spread of COVID-19 in Nevada and support people that need to be remaining home to do so.
The pandemic's not over, and our seniors are just as susceptible as they were when it first started. So Nevada Can is going to be more instrumental now as we're opening and as people are going out, because it is so vitally important that the seniors do stay home and do guard themselves from this virus, because it's not going away.
Dena, what can the rest of us be doing to support the seniors in our community?
Nevada Can has an opportunity where people can volunteer through our organization, and we can connect you to community partners that are helping to deliver food and essential needs, as well as there's also volunteer opportunities for those who want to help people connect socially. and connect to seniors. But I would just encourage everyone to do exactly as you've done, Connie, and that is check in on your neighbors. If you have neighbors who are older adults, check in on them, see what you can do to help them. And then as a whole, I think we all just need to be precautious, right? We need to follow the CDC guidelines, be washing our hands, social distancing, wearing masks when we're out in public, and really just trying to be kind and patient with one another, and understanding that everybody has a response that's a little different. And for those folks that are older or have underlying health conditions, this can be a very scary time for them. And so we all need to be patient and kind with one another during this process.
It doesn't take a lot of training to be a volunteer for Nevada Can. It just takes being a good human being.
And I would add that the volunteer opportunity, many of our volunteers were finding that it's actually a mutually beneficial, right? They volunteered to help somebody else, but they're finding the benefit for themselves in that connection. So many of our seniors have so much to offer. And so the benefit is mutual. It's an amazing opportunity for folks to connect with one another and meet somebody new.
The seniors, you matter just as much to me as my own family. And I think that what we're really trying to do is just ask the general population to keep them in mind, understand that senior citizens and those who may have illnesses, we don't all know, and this isn't highly contagious virus right now. And the best thing that we can do as to be good citizens is to take those precautions and wear those masks when we go out into public places, to wash our hands, and to just really be gentle, I would say, to one another right now.
It's not just the senior population. Anyone with a pre-existing condition that makes them very susceptible to this.
Dena, you talk a lot about speaking to seniors directly, but I would also say that Nevada Can is a vital tool for individuals who have seniors at home, if they're concerned about their parents, if they're concerned about neighbors. This tool is also available to those who are concerned about seniors in our community, correct?
That's correct, Connie. Anybody who has a friend, a family member, a caregiver, even if they're calling from out of state and they aren't able to come to Nevada to support their senior, they can certainly call 211 and ask for Nevada Can services and just give us their information. Let us know what their needs are, and we will reach out to that individual. I think that during this time, it's important for us all to remember that we all need help during this. This is an unusual time for all of us. There's nothing normal about being asked to self-isolate. And so Nevada Can really is just a resource and a simple way to connect everybody that needs services to their community. It's not an assistance program, it's just a connection. We wanted to make it as easy as possible for friends, family members, and individuals needing supports and needing help understanding what is available in their community to stay at home. You know, a lot of us have never had home delivered groceries or never had to have our medications delivered. And we're learning that there's so many community partners who have stepped up, changed their business model in order to support that. And so our goal is really to be that resource link and get them connected to the services that are available in their community that they may never have needed before.
One thing that we don't think about is when our family members are in crisis, say we have an adult, or excuse me, say we have a senior living apart from us, that is a crisis for us, we the family. And I want to talk to the families about how important you are to your senior and that you reach out for them. Not just that you reach out to them, but if you're seeing they need assistance, you're worried about them, you please reach out for them. Reach out to Nevada Can, reach out to Crisis Support Services of Nevada. Family members, you too are important. You're important to your seniors. Your seniors need your help. So if you're feeling anxious or overwhelmed and you don't know what to do for your loved one, please either call Nevada Can so you can get their assistance, or call Crisis Support Services of Nevada.
I would absolutely agree with that. And I would encourage anyone to please call 211. If you have a senior, you know that they are looking for assistance for your family, and it is an absolute vital tool. And I again wanted to say thank you so much to Rachelle Pellissier, the Executive Director for Crisis Support Services of Nevada, for putting on our Talk It Out Tuesday episode. And again to you, Dena Schmidt from Nevada's Department of Health and Human Services. Thank you so much for being a part of Talk It Out Tuesday. This has been a very educational episode, and we just greatly want our seniors to know that you are a vital part of our community. We want you to be safe, we want you to be healthy, and we want you to reach out if you need those services 24 hours a day, 365 days a year. You can call 1-800-273-8255. You can also go to their website, which is CSSNV.org. And of course, you can also text CARE to 839-863. And we also want to remind you that Crisis Support Services of Nevada is a charitable organization helping all of Nevadans and people across our nation. It's a great opportunity for you to give back to a nonprofit that is doing great work in our community. And you can do so by visiting their website, again, at CSSNV.org. And we look forward to seeing you again. Talk It Out Tuesday is now going to be once a month. That's right. We're going to be turning this into a once a month format. It will air on the first Tuesday of every month. So mark your calendars. Our next episode will drop on Tuesday, July 7th. And again, thank you so very much for joining us for Talk It Out Tuesday.